So my second video on cervical cancer. So sometimes it looks like people don't appreciate what or which parts of the body this cervical cancer affects. So the word cervix actually means neck. So the bone in your neck is actually called the cervical spine. And so cervix means, when we refer to uterine cervix, it means the neck of your uterus. So it's at the tip when you are getting into the uterus, that opening, that's what we call the cervix. So I have a picture up there for you to have a look, and that is where the cancer starts from. Now how would one know that someone has cervical cancer? Usually it presents with bleeding, what we call an abnormal uterine bleeding. You would either bleed during sex, or after sex, because there's usually what we call contact bleed. Anything that touches the cancer on the cervix causes bleed. So either the person has sex and sees blood, or after sex you see blood come, what we call postcoital bleeding. Some people also have intermenstrual bleeding, so they'll bleed outside their menses. But because majority of cervical cancer occurs in older women, postmenopausal women who have attained menopause, any woman who bleeds after the period of menopause is a red flag for a cancer. So if you have a mom at home, a grandmom at home, who went into menopause about 3, 4, 5 years now, and now she's complaining of seeing spots of blood, she's bleeding, no matter how small it is, do not take it for granted. There was a woman, there are other cancers that can cause you to bleed apart from cervical cancer. But this month we are just talking about cervical cancer. I remember someone who came to me with a postmenopausal bleed, was trying to downplay it. I wanted to do an endometrial biopsy. She was trying to say that the bleeding has stopped, or it doesn't come all the time, so she doesn't want to. Eventually, when I did endometrial biopsy, it came out that she had endometrial cancer. So please, if someone has attained menopause and sees any form of bleed, do not take it for granted. It is a red flag and needs to be investigated. And if you are a woman experiencing any form of abnormal bleeding, intermenstrual bleed, postcoital bleeding, that's bleeding after sex, any abnormal bleeding, please get evaluated, because that is usually the biggest sign, the biggest symptom of a cervical cancer. Then when you go, the doctor will have a look at your cervix and decide what to do for you. So bleeding is a key thing. The other things that can happen are usually when the cancer has spread or is advanced, like you feeling a mass in your lower abdomen, or a swelling in your lower abdomen and all that. But bleeding is very key, so do not take any bleed lightly.